P. Comillas from Bachelor of Science in Nursing Section B. And for today's video, we're going to demonstrate how to check vital signs. Now, what is collected during the vital signs? Well, you will be checking the client blood pressure, the heart rate, the respiration, and the temperature. In addition, you will be asking the client their pain rating, which sometimes referred as the fifth vital signs, along with collecting their oxygen saturation.
First, you're going to perform hand hygiene. So that can prevent the transmission of microorganisms. And don the appropriate PPE if necessary. Like if your patients and contact precautions, you'll want to put on the correct PPE.
I am your nurse for today. May I know your name, sir? Can I check your armband, please? Okay, we will be taking your vital sign. Is it okay with you?
It are the utmost importance. Ensure patient privacy. Drape the client if necessary. Place the client in appropriate position.
So now, we're going to ask his pain level. So sir, can you tell me what is your pain level from 0, which is no pain at all, to 10, which is the worst pain? 0. After assessing the pain, I will be collecting his oxygen saturation. I will be using the pulse oximeter, which is this one. And I will put it in his finger, which has a good circulation of blood.
After the device, place on the finger and let it get a reading and hear the patient's oxygen, which is 98%.
Now, I am collecting his body temperature. Now, I will be opening the thermometer. This one. Arjo, huwag ka tabing.
Place the thermometer in the clean and dry axilla with the appropriate amount of time.
When the client's armpit is sweaty, you will get a towel to tap it and make it dry.
While waiting, select the pulse point, normally the radial or apical pulse as required. Palpate and count the pulse. Place tips of first 2 or middle 3 fingers lightly and squarely over the pulse point. Do not use your thumb to assess for pulse. Count the pulse for 1 full minute. Count for a full minute. Assess the pulse rhythm and volume. Start counting while looking at the second hand of a watch. Ideally, count for 1 full minute. Observe character of respiration, depth of respiration by degree of chest wall movement.
Your body temperature is 36.6, sir.
Discard the cover, wipe with tissue if necessary. Wipe it with wet cotton balls with alcohol and and dry it with tissue or dried cotton balls.
We will be doing the blood pressure. I will be taking his blood pressure.
The client should be sitting unless otherwise specified. Both feet should be flat on the floor. The elbow should be slightly flexed with the palm of the hand facing up and the arm supported by the heart level. Rub the deflated cuff evenly around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. Position the stethoscope appropriately. Insert the ear attachment of the stethoscope in your ears so that they tilt slightly forward. Auscultate the client's blood pressure. Pump up the cuff until the sphygmomanometer is 30 mm mercury above the point where the brachial pulse disappeared. Release the valve on the cuff carefully so that the pressure decreases at the rate of 2 to 3 mm mercury per second. As the pressure falls, identify the manometer reading at correct cuff phases 1, 4, and 5. Deflate the cuff rapidly and completely. Document the findings in the client's record.
That is the wrap up of our demonstration video for how to take vital signs. So, bye!